Ma'am, first things first, thank you very much for your time here on Mirror Now. It's your last day at the WHO, so a double thank you for speaking to us today. You still had 2 years to go. Why are you coming back earlier? Are you homesick, or do you think that your job at the WHO is done?
Thank you very much, firstly, and it's a pleasure to be with you. Yes, it is my last day at WHO, and I have completed 5 years here, which I think is a significant amount of time to have done a body of work. I was very privileged to have had the opportunity to create the science division, which was a new division, and to be the first chief scientist at WHO, and especially to have served the organization during the pandemic, when there was a huge need for research and data and evidence to inform the policies, that not only had to be made in a timely manner, but had to be updated from time to time based on the new data that we were getting, on the new understanding that we were getting. I was also able to lead COVAX, which was the initiative to develop and distribute vaccines for the developing world. And 2 billion doses of vaccines have been distributed through COVAX, mainly to low-income countries. And then having set up some of the processes within WHO around the way we do our norms and standards, the way we do our guidelines and recommendations, and also work on digital health and innovation. I feel that, I contributed at a time which was very challenging for everyone, for the whole world. And now it's time to come back to India and to work again and be, of course, with family and friends.
Ma'am, can I then ask you to look back, especially to the time of the pandemic? What were the pandemic years like for you? You've told us a bit about what you did at the organization. At a personal level, what was it like for you being a scientist at WHO? And how did the pandemic perhaps change the WHO? We know that it certainly made it much more visible. But beyond that, if you look back at the pandemic, what is it that you take away for yourself personally and for the organization as well?
Yes, that's a really good question. I think it will take some more time for everything to really sink in and for us to be able to look back and analyze it very well, because, we're still in a little bit of an uncertain phase, though we believe that we may be coming to the end of, at least the acute phase of the pandemic. I think for me personally, what I was actually very happy to witness was the tremendous progress that has happened in science and technology around the world, and how the investments that have been made over the last several decades really paid dividends during this crisis, starting from, literally hundreds of different types of diagnostics, point of care tests, to, of course, the huge number of vaccines using different platforms that have been made, the research that is being done into antivirals, the clinical trials that were done around the world, the innovations that we saw in digital technologies and tools being used in countries, and the whole focus on science and the fact that science became a daily topic of discussion amongst the lay public, and hopefully will attract more young people to science in the coming years. For me, was the overwhelming silver lining of the pandemic was the attention that every country and every individual now pays to science. But I must say that on the same vein, that while science showed us what can be achieved, and especially if you work together, collaboratively in solidarity, we also saw the ugly side of misinformation, disinformation, anti-science, and groups who are trying to erode people's trust in science and in credible organizations. I think as we look ahead, it's important for all of us to think how, as rational people, can we actually limit the influence of these anti-science groups, which can have a very detrimental effect, on vaccination programs, by seeding doubt where there should really not. There can be genuine questions and debate should be encouraged, but false information is a very dangerous trend, which unfortunately through social media now is able to reach millions of people very quickly. So for me, the personal lesson that I learned was that when we come together and work together, we can achieve miracles. But when there is division, or when there is politicization or when there is hatred, then everything can go wrong as well. And that it's a responsibility as a responsible public health leader or a scientist to always speak up for the truth and for facts. I mean, there is no one truth in science. The other thing I've learned is that things change. One has to be humble. And what we knew in February of 2020 about the virus is very different from what we know today. And so you have to change also your ideas and views and the policies accordingly.
What about the WHO itself, ma'am? I do remember initially there was a lot of politics about, the WHO chief's relationship with China, etc. A whole lot of it was politicized. I don't think it helped anyone's cause. But apart from the visibility that the WHO has got during the pandemic years, all of us were looking towards the WHO for advice and guidance, etc. But apart from the visibility, do you think it's added to the body's credibility as well, despite the initial politics that surrounded it?
I do think so. I think large parts of the world depend on WHO. They did before and during the pandemic and will continue to. And one thing I'd like to say is that WHO is a member state organization made up of, the 194 member states. They actually are the ones who give direction to WHO. They are the ones who set the rules and the framework within which WHO operates. Things like the international health regulations are actually rules that are debated by member states and agreed upon. So the secretariat of WHO, like us, who are staff members, of course, are doing a lot of the work on policy, but it's all informed by both member states when they meet during the executive board or World Health Assembly, but also by expert advisory groups that are composed of global experts, in every field. And so I think that's something that people often don't realize. And the fact is WHO is only as strong as the member states want it to be. And now there's a lot of discussion about the need for a strong global health organization, which is WHO. How can member states make it stronger, more accountable, as well as more responsible? Give it more authority and then keep it accountable. Give it more funding. Funding of WHO is less than the funding of any one single large major hospital in the US. And it's supposed to do the whole of global health and look after people's health around the world. So I think that we have a great asset in WHO. It belongs to the people, it belongs to the countries. And I hope that they will continue to strengthen and shape it and finance it well so that it can actually do the work that it's supposed to do. And yes, politics, will always be there. But the secretariat, again, tries to be as neutral as possible and stick with the facts and the evidence. And I think that's what we did through the pandemic. There were attempts, of course, to politicize the work. But I think the Director General and all of us always said, we will keep informing the public as we know more, as we learn more. We will share transparently. As you know, there were daily press conferences in the first few months of the pandemic. So from our side, all effort was being made, to keep open and good communication lines. But I think the organization, obviously, everybody learns lessons and no one is perfect. And so I think learning what could have been done better and trying to improve it for the next pandemic or epidemic. This happened after H1N1, it happened after Ebola. Every time there's an improvement, there's a strengthening of systems. Whatever was found to be the weak links, you need to strengthen those. So those, of course, will, there's continuous improvement that has to happen in any organization.
Ma'am, my next question will sound rhetorical, but since the US president has said it, I think I can risk saying it on national television and asking you this question without sounding stupid. Is COVID over? Is it done and dusted? Do we not need to worry about it anymore?
So Shreya, the answer to that question is that we actually do not know what the future holds. What we have seen this virus do over the last 3 years is to evolve and mutate and change continuously. As you know, we have lots of variants. We have Omicron. Luckily for us, Omicron, which came about exactly a year ago, November 2021. Till today, there are 500 sub-lineages of Omicron, but there has been no new variant of concern with very different properties. And so we have felt a little bit confident that the vaccines, the tools we have, the immunity that has developed largely now is protecting people. But will there be another variant that becomes more severe and completely is able to bypass the immunity that we have? We really can't, nobody can predict that. And the fact is that COVID, the virus is not going anywhere. The virus is here to stay. It has become deeply embedded not only in the human population, but in many animal species. And therefore, we will need to live with COVID responsibly. We know now how it spreads. We know what steps we can take to protect ourselves and protect others. Vaccines, masks, good ventilation, staying home if you're sick, if you're in a crowded place where you're feeling you could be at risk, put on a mask. I think these things are lessons, for us forever. There's no one day when we say, okay, now let's drop everything. That's not going to happen because COVID is a new virus, relatively speaking. If you look at the history of pathogens, it's only 3 years old. It's continuing to change. And like influenza, we've had, for many, many centuries, and we still take precautions against influenza. We still take vaccines, and it still kills people. That's the future of COVID. It's going to be around. There will be some vulnerable people who will get very sick probably and die, but our goal should be to minimize the deaths, minimize the long-term effects of COVID by taking sensible precautions.
So, doctor, are you saying that we need to take it as seriously as the flu? That if you get it, take precautions, don't go near people, mask up, take a vaccine if it's possible, and that's that. Don't stress about it beyond that.
I don't want to say that it's just like the flu because of one important difference, Shreya, and that is that COVID causes long-term sequelae that we have not seen to this extent with any other virus. And so it's not just a simple respiratory infection. Sometimes it leads long-lasting damage in the body, which is not visible, but which can manifest later. So as far as possible, it's better to avoid getting the infection. And this is why the third dose or the booster dose is important. Even though it doesn't protect you fully against infection, it will reduce the chances of you're getting it and the chances of you're getting sick. So if people still haven't had their booster dose, the third dose, it's a good time to get, especially if you're over 60 or if you have some underlying, hypertension, diabetes, etc. So we cannot compare it with any other. We have to watch, we have to continue the surveillance. We have to continue to be prepared and strengthen our health system. So if in the future, suddenly we have a new variant, our health system is able to respond to it.
Ma'am, have you, as a scientist, been able to understand the extreme resistance to the booster dose or the third dose? I ask you this question because in countries like India, in the United States as well, vaccine doses are being junked because there are not enough takers for it. I understand there are some parts of the world where the vaccine coverage is less than 10%, but in countries where there is sufficient vaccine, like in India, people simply don't want to take the booster dose. Is it politics that is keeping them away, or is it the sense that khatam ho gaya, it's done, it's over?
I think it's a combination. There are many reasons for people not taking the third dose. One is complacency. The pandemic overall is at a much lower intensity than it was a year ago. You don't hear of a lot of people getting sick or getting hospitalized. People have had their primary course, which is really important, and many people have also had natural infection. That also boosts the immune response. But I also think that, so there's complacency. There's also, in some cases, I think the lack of being able to access health services. Certainly in many countries, people have to travel, not in India, but in other countries, people have to travel long distances, or they come back disappointed because the vaccine is not available in the health center. And thirdly, there is, as I mentioned, this anti-vax movement. Again, luckily in India, we haven't seen it play that important a role, but we've seen, for example, these anti-vax movements which start in high-income countries actually pervading into Africa and causing a lot of vaccine hesitancy in Africa, because a lot of people depend on WhatsApp messaging for their information, and sometimes you have absolutely false things circulating in WhatsApp. So this is a challenge. It's a challenge for ministries. Plus, there are many countries where the health system is inherently weak. They are having conflict situation. There are refugees, migrants, health workers are not paid. So there are a set of very weak countries in which it's really difficult to expand vaccine coverage. But I think as far as India is concerned, we've done well with the primary course. We have very high coverage among adults. And for the booster, I think it's still not too late for those who haven't had a booster to go ahead and take that, because the third dose is important for good protection.
Okay. Ma'am, politicizing a pandemic or vaccines does not help anyone's cause. I think all of us agree to that. But in the last few weeks, that the pictures that have come out to us from China seem to speak of, the growing frustration with the country's zero COVID policy. What is the view of the WHO and your view about how China is going about its zero COVID policy?
So as you know, Shreya, the WHO makes guidelines based on whatever the latest science is. The guidelines are made, of course, for the whole world, but then they need to be adapted and adopted at the individual country level. And if asked for advice, we give advice, but we don't necessarily have an influence on what a particular country wants to do. So each country has made their own national strategy and guidelines and approached COVID, sometimes in slightly different ways. In the case of China, of course, they had a very strict zero COVID policy, which helped them to keep at a minimum the deaths, so there were a few countries that had very strict policies in the early stages of the pandemic, including countries like Australia, New Zealand, Japan. The deaths have been very low, relatively speaking, in these countries. As tools became available then and vaccines rolled out, obviously then many countries opened up. And I think China is now in the stage of ensuring that its elderly population has high vaccine coverage before I think they lift all of their. So what I see is that they're lifting some of their restrictions. They're trying to do it in a stepwise way, and they're trying to do it to minimize the impact that a massive Omicron wave could have on their population, particularly if they have elderly people who have not received vaccines or a booster dose. So that's, I think, the approach that they've taken. And obviously, WHO has always said that as we have moved through different stages of the pandemic, our response has to be adaptable to that. And what made sense early in 2020 doesn't necessarily make sense anymore. But again, each country assesses their own risk, the situation they're in, their vaccine coverage, and then proceeds accordingly.
Has it seemed heavy-handed to you, ma'am, on a personal level, when you see pictures coming out on television screens?
It's very hard to say, because one is not there and experiencing the situation, and sometimes you just see few images. So it's hard to come to conclusions about that. But again, it's not for us to comment on how a particular country or government is handling the response. And we've seen many countries being successful, others making mistakes and then trying to correct themselves. It has been a challenge for all. But I think the goal for everyone is of course, to keep the deaths low and to increase immunity because of vaccination, because you can get immunity through vaccination or natural infection. And obviously getting it through vaccination is a safer way. And so they had a lower coverage in their elderly group, and I think that's their main concern now, is not to let Omicron come through the population before everybody's well protected.
Ma'am, my last question to you before I let you go. There have been, when it came to COVID vaccination, I know that in the last 3 years, there was such a lot of focus on vaccinating people against COVID. The impact of it is that, of course, all of us have got the first dose, the second dose possibly as well, people not very keen on the third dose. But suddenly we see in India now an outbreak of measles. What explains it, and is this the experience across the world, that while everyone was focusing so much on COVID vaccination for other diseases, well, that went completely out of focus?
It's true that we're seeing lots of measles outbreaks around the world in many countries, and the fact is that routine health services were disrupted significantly across the world. And this applies to both, outpatient services, community-based outreach services, as well as in hospital, like elective surgeries, for example, were postponed and delayed because hospitals and doctors were busy managing COVID. So there's been an impact on many programs, on the tuberculosis program, on NCD program, on HIV, and definitely immunization coverage dropped. And the report that WHO and UNICEF came out with a couple of months ago showed that the year 2021 was even worse than 2020. And we had something like 25 million children around the world that had either no immunization or inadequate. And so a disease like measles, but also polio, we've been seeing polio resurgence. This depends on very high vaccine coverage. You need more than 95% measles coverage to prevent measles outbreaks. And now it has slipped below 85 or 80% in many countries. So I think that's what we're seeing in India as well. And I think the government is already making efforts actually to ramp up immunization coverage and to make up for whatever was lost last year in terms of uncovered children. So I think with these catch-up programs, we should be able to hopefully overcome those gaps that were seen in the last 2 years. But this did happen across the board in many countries, and it happened not only for immunization, but also for other health services.
Dr. Swaminathan, thank you very much for your time. Thank you for your service. And what can I say except welcome back home. See you soon. Thank you so much.
Thank you very much. Pleasure.